I'm Rachel from I Need IVF, and today I wanted to do a little bit of a chat with you about the drugs that you might come across while you're going through your IVF process. So we'll talk a little bit about what they do and how they'll make you feel, more importantly, and anything you really should be kind of aware of before you go into your IVF. So the first drug you'll probably come across is down-regulation drugs. Down-regulation drugs are basically meant to take over your cycle, so they're meant to thin your lining and stop your follicles from being active, growing, and just keep everything really nice and quiet in your uterus. So they are known as, here's the technical terms now, gonadotropin releasing hormone agonists. Bit of a mouthful. But essentially what they do is they stop the release of FSH, which is follicular stimulating hormone, and LH, which is luteinizing hormone. So essentially what that does is it stops you from ovulating, it prevents estrogen production, and it thins your lining. So there's a couple of different main ones that we use in the UK. Buserelin is the one that I was on. And there's two different types of buserelin. There is Supracur, that's the manufacturer's name for it, which is a nasal spray. And there's Suprafact, which is the injection, which is what I used. Some of you might also be on Lupron, which again is an injection, or you could be on Cinerel, which is a nasal spray. So like I said, there's a couple that are nasal sprays, and some areas will use those, and that is literally what it says on the tin. It's a little spray into your nostrils. The only things that women have mentioned about that is it often gives them like a dry throat, or they feel like they can feel the medication kind of dripping down the back of their throat. So some women don't like it for that, but a lot are very keen to do that rather than the injections for obvious reasons. And then Lupron or Suprafact, which is the buserelin injection, are done as what we call a subcutaneous injection. So what that means is that you have different layers in your skin. Your skin is made up of several different layers. The top layer, so the one that is just right underneath here, is called a subcutaneous layer. So essentially what you're doing is you're doing an injection into that layer of skin. So the great news is the needle is not that big. It's quite small. It probably doesn't look it when you first have to do it, but the good news is you're not going all the way to the muscle like you might do with other injections. Most commonly women like to use their stomachs for it, and clinics will usually teach you to do your injection in your stomach. They might also talk about doing it in your thigh. That's a personal preference. I'm not a big fan of doing injections into my legs, but you're essentially looking for any area that's got a good amount of kind of fatty tissue. The whole process will be gone through by your nurse at your clinic, and they'll teach you how to do the injections. But advice just in general on doing them is try and get a really good piece of skin and hold it really tight, because what that does is it stimulates the nerves around it, and then when you're doing the actual injection into your skin, you don't feel it quite so much. My other advice is don't go slow, dart. So if you dart it into your skin, it just doesn't hurt quite so much. I didn't find the injections too bad, but as you know, I'm a nurse, so I've done a lot of injections, although admittedly not on myself. Some ladies like to teach their partners to do it, and their partners will do their injection. That's absolutely fine. It's whatever works for you. I didn't really have that option because I work shifts, so I had to do some of my injections at work anyway, so I was always going to have to do them myself. but just remember that you can always ask your nurse to teach your partner to do them, and you can get them to do them if you really find needles difficult. So how does it make you feel? So essentially what it's doing is it's sort of almost putting you into a mini menopause. So a lot of the side effects are very similar to that you might expect if you were going into the menopause. So the most obvious one is feeling a bit emotional, not quite yourself. I found that I did, but it was a bit later into my down regulation. I think the first few days I wasn't too bad, and then that kind of hit me. Other things, hot flushes, as you might expect, the good old hot flush that you get through menopause. What else? Headaches are quite common. Excessive thirst, or or not feeling thirsty at all, either way, can be quite common. Like cramping, bloating, all of the things you usually expect. You will get a bleed during this. It's not technically a period because you're not shedding like your uterine lining after you've ovulated, but you will have a bleed to thin your endometrial lining, so it's important to look out for that. I was just going back through my diaries, and I think for me I had that somewhere around day 9 of being on the drugs, but everybody's a little bit different. As long as you've had it within the period that you're taking the drug, then that's okay. Although do note that if you're on a short protocol, you will have just had a period, and therefore you may not need to have an extra bleed if you're on the short protocol. Long protocol, you will find that you definitely need to have a bleed in that kind of period, however long it is you're on the drugs. Looking back, each time I was on them 21 to 24 days on a long protocol. So the next lot of drugs we're going to talk about is the stimulation drugs. Although in advance I'm going to apologise in case this camera shakes, because my cat has decided to sit on the thing that is holding the camera in place. Right, so there's 2 types of stimulation drugs you can get. The first type is called phallotropins. What these do is they stimulate you by essentially you're injecting follicular stimulating hormone. So what that will do is thicken your lining, help your follicles grow, and help your eggs mature. The second type of drugs are called human menopausal gonadotropin. Yes, gonadotrophins. I didn't have to look that up at all. So they work by not only giving you FSH like the phallotropins do, they also give you luteinizing hormone, and I can see my cat right behind you guys being a bit crazy, so I'm getting very distracted. And it works in the same way. It's looking to thicken your lining, help your follicles grow, and help them eggs mature. The most common phallotropins you will probably come across in the UK is Follistim or Gonal F. These are really common ones. And then for the human menopausal gonadotrophins, Menopur is the most common, but there's also one called Merional, although I've never heard anybody talk about being on that one. Personally, I was on Menopur, so I was on one of the drugs that had both the FSH and the LH. These are all injection based, and again they're subcutaneous, so they're that tiny little needle, and they'll be administered in a similar way to your down regulation drug if you're taking an injection based one of those. So tiny little needle and a big wad your fat, and pop it in nice and quick. They can sting. I know for me Menopur really did have a bit of a sting to it, but it's very temporary, it doesn't last very long. Important thing with any injection is always rotate the site you're using. So I used to have to keep a record in my IVF diary of whether I'd done left, right or middle, so that I would know which side to go the next day, because I couldn't always remember. You probably will end up with a couple of bruises here or there, so it might be a bit tender, so just obviously avoid the bruises when you're going for your next injection, because stabbing into a bruise is probably not what you want to do. And like I said, you can use up your stomach or your thigh, and that's a personal choice. So the side effects pretty much are the same kind of thing that you would get with the down regulation drugs. All of these drugs are hormonal based, so they give you similar kind of feelings. I'm having a little bit of a look at my IVF diary, and on here I noted in my first cycle that on day 5 I started to get like really crampy, bloated, headaches, a bit emotional, hot flushes. I had some backache as well, and I was really tired. However, I've also noted that that all kind of eased off around day 8 or 9, and I had my scan done on day 9 of that cycle. So even though you will probably get some of those symptoms, you might not get all of them. Everybody's a little bit different, it really just depends. The most common ones on these drugs are going to be the cramping and the bloating, and the general heaviness down in that area, because essentially what you're doing is you're growing really big follicles, so your ovaries end up kind of quite big, because if you're thinking you're trying to grow them to about 12 to 20 millimeters each, so if you've got, 3, 4, 5, 10 in each side, your ovaries have gotten pretty big, so you're going to feel really heavy down there, and it can be quite uncomfortable. I remember we did a long trip to see some of my friends down towards the Midlands area, and we had to stop off quite a few times because I couldn't sit in one position for a very long time. I had to keep moving because I was feeling quite bloated. I'd recommend making sure that you've got a few clothes in your wardrobe that have kind of got a looser, like elasticated waist maybe, just because that can really help, because you don't want, tight skinny jeans and things around your abdomen during that point, and you can look a little bit preggers, to be honest, which is the last thing you really want when you're going through IVF, isn't it? But all for the good of getting that baby. Right, so the next one we're going to talk about is the HCG trigger injection, not shot, too American. So what is HCG? HCG is essentially human chorionic gonadotrophin. Say that quickly a few times and you'll get yourself in a right twist. But it's often known as the pregnancy hormone. It's the one that we test for when you do that lovely pot of pee, or you go into a clinic and get that blood test done. So why are we suddenly, giving ourselves that right before we go for egg retrieval? What it is actually doing is it's helping your follicles and eggs mature, and getting them ready for that retrieval. It will also cause you to ovulate, but somewhere between 34 and 38 hours after you give yourself the injection. The important aspect of that is you have to take the injection at the exact time that the clinic tells you to, because they will sort out your egg retrieval for the correct time, based on what time you gave yourself that injection. So they will usually bring you in around 36 hours after you've done the injection to retrieve your eggs, because they want to retrieve them before you ovulate them all. And if you ovulate them all, you would be really mad at yourself, and to lose all of that hard work through it. So tip number 1, take it exactly at the time you're told to. It is another injection, I'm afraid, but again, it's a subcutaneous one, so all the same things apply in terms of doing subcutaneous injections, and your nurse will show you how to administer it. It's often given to you in like a pen, which makes it a little bit less fiddly. You're not having to draw things up and such. and usually there's just a little twisty dial at the end that you twist up to the right number of units, and like literally just press it in and push down on the pen, and it injects it for you. If any of you know anybody or suffer with diabetes yourselves, it's very similar in terms of how those little diabetes pens work. The important aspects of it is it has to be kept in the fridge as well, because it's one of the ones that won't last outside of the fridge. It doesn't, like for me, it never really gave me any side effects at all. It is literally a one-off injection, so it doesn't have the time really to build up in your system. The important aspect is it does last in your system for a good few days. So if you're the kind of person who likes to do your pregnancy tests early, it really isn't advisable until you've got about 10 days after your injection, because it'll need that amount of time to get out of your system. So all you'll end up doing is getting a false positive test. And then obviously if unfortunately you're not successful in your cycle, it'll be really upsetting later on to realise that unfortunately the early tests you had done were just because of this HCG trigger injection rather than you actually being pregnant. Everybody has a slightly different dose. Again, the clinic will go through what you do. I think mine was something about around 6,000 international units, but everybody has a slightly different protocol. Some people will be put on a daily dose of this in a very small amount, but that will all be to do with your diagnosis and how your clinic works. The most common is it's just done as a one-off trigger rather than as a regular injection, but there are some clinics that may ask you to do it on a regular basis. So the final drug I'd like to talk to you about is progesterone. So progesterone is exactly what it says it is. It is progesterone, so it is one of the female hormones, and it's used as what we call a luteal support drug. So the luteal phase is the phase after you ovulate normally, and some women will be quite familiar with this if they've had any diagnosis of kind of difficulties in their luteal phase, and they will have been on progesterone before. In IVF, you go on progesterone to help maintain your lining, to encourage implantation, and to support early pregnancy. So you start taking this once you've done your egg retrieval. So the evening of your egg retrieval will be the first time you do your progesterone. You can do it in 3 different ways. It can be a pessary, which has 2 options. You can either do it as a pessary, so you can do it as a vaginal pessary, or you can actually do it as a rectal suppository as well. And your clinic will have a preference with that and will let you know which way they advise you give it. Personally, I'm very much more of the vaginal pessary kind of girl than the rectal, but you know, each to their own, and whatever makes you feel more comfortable is absolutely fine. There's also a gel which is inserted vaginally as well, and then some people will go on to an injection which they call progesterone in oil. This is what we call an IM injection, so that is an intramuscular injection, so that has to be done in the buttock, and you'll be shown how to do this. Unfortunately, because it's going into your muscle, it is a bigger needle, and you will probably need somebody to do that for you, because trying to inject into your buttock yourself is really quite difficult. So you would probably need a partner or a family member or a friend to help you give that injection. So the 3 different names that you'll probably come across, if you're having it, is the pessary version. You'll probably hear the name Cyclogest. If you're having the gel, you might have something called Crinone, and if you're doing the injection, it's usually called Gestone, or just progesterone in oil, or PIO for short. How does it make you feel? So for me personally, this was actually the worst one, which I'm sure is very encouraging. I think the really difficult thing with this one is, like all the others, it's a hormone, so it makes you feel very similar to the others, but I actually found that symptoms like nausea for me were a lot worse on the progesterone, which is something you really don't want to experience when you're waiting to find out if you're pregnant, because it pretty much tries to convince you that you are, even though you know it's just the drugs. It made me feel really crampy. I got a lot of hot flushes on it. I was very emotional. God forbid anybody put a picture of a distressed animal in front of me, because I would have been in floods of tears, kind of like I am now, to be honest. So it's one of those, and I think the reason I found it hardest was because it was giving me all of those pregnancy type symptoms that people talk about, but with the knowledge that it was just drugs making me feel like that, and not necessarily because I was pregnant. My other cat has now just wandered in and decided to wander around meowing at me like I haven't fed her. So really, it was kind of that was the worst part of it for me. But I think the overall thing is, every woman is different. Everybody's going to have different experiences on these drugs. And even for me, having done 2 cycles, I found that the symptoms were different each time as well. Or, I might have the same symptoms, but they were worse at some points and better in other times. Oh, you come to join us, have you? Thanks for that. So really, it's just a matter of getting through it day by day, and just remembering that it's totally normal. However you're feeling, however you're feeling is, pretty much normal for you. The only thing I would say is, if you get, at any point you're getting excessive pain, or there's something that really, really is concerning or bothering you, then talk to your clinic and just make sure that is okay. But if you get any of these common symptoms, it is quite normal to feel those. And just really good luck with your cycle, and we wish you all the best. If you really like what we've talked about today, then feel free to subscribe and like our channel. We're a new channel, so we'd love to have you as a subscriber supporting us, and the more support we can get, hopefully the more videos we can get. See you later.